Hi, how are you? I'm Dr. Steinberg, and nice to talk to you. So, my name is Dr. Jeff Steinberg, and I'm talking to you on my cell phone as my camera didn't work. So, we're all trying to get by and make the best of a very difficult situation. So, I'm a board-certified neurologist. I have subspecialty training in sleep disorders and pain management. My practice is called the Headache and Pain Center of South Florida, located in Plantation, Florida, but I see a lot of other medical and neurological problems, such as people who have chronic or acute pain, whether it's migraines, neck or lower back pain, it's due to an injury. I see people with cognitive problems, from traumatic head injuries, ADD, Alzheimer's. I also see various other neurological problems, whether it's neuropathies, Parkinson's, strokes, MS. But today I want to talk to you about insomnia and anxiety, especially during this pandemic. A lot of people have anxiety, and it's interesting because even the president was asked a question about it during his press conference last night, and I'll discuss what he said and what he really, I think, meant to say. But what is anxiety? So anxiety is anyone who has excessive worrying about many different topics through most days of their lives. Okay, the other one is that they're stressed, and also that it lasts for more than 6 months. So you can still have anxiety now, but if it perpetuates, then by definition, that doesn't mean you don't have anxiety now. Just that's the medical criteria. And there's different types of anxiety. There's general anxiety, there's post-traumatic stress, and then there's panic attacks. General anxiety, typically someone feels chest tightness or pressure. It can be shaking of the hands, tremulousness, lightheaded or dizziness. It can present in many different ways. One way you can detect it yourself is checking your pulse. If your pulse starts going up, if your blood pressure starts going up, that's some of the physical symptoms that we call about anxiety. But, it can mimic other things, such as heart attacks, and that's what a panic attack feels like. So if someone's been experiencing a panic attack, it feels like that. Chest pain, chest pressure, palpitations, like you're going to pass out, dizzy, but it happens suddenly. And sometimes you know what causes it, and other times you don't. And if you can't figure out what triggers it, then that's where you can seek professional help, and they can help you with that. And, that's how some of the treatments are involved, is psychotherapy. And the other one I wanted to bring up was post-traumatic stress, PTSD. And the first two letters, T and S, traumatic stress. And if anyone doesn't think we're going through emotional trauma right now, you're mistaken. And some people, had anxiety, and this just really exacerbates it. And other people, were either functional anxiety people or didn't have it. But during this time, you can. Think about it. The reasons for this anxiety: lack of control. You can't, people, the government for trying to take care of us is telling us what to do. You don't have any control of your day-to-day lives. The uncertainty of this. First, we're saying, it's a couple weeks. Now it's, home seclusion till the end of April. We don't know when this is going to end. So uncertainty also provokes or precipitates anxiety issues. And the other one is financial burden. How are you going to pay your rent? How are you going to pay for the toilet paper? I mean, these things can add to the stress and therefore anxiety. And also, obviously, there's risk of death. I mean, if we have elderly parents or someone who's chronically ill, especially if they have respiratory issues like asthma or COPD, they're at higher risk to have this, and I'm sure we're concerned about them. So, these are the things that can add to the anxiety and why so many people are having it. So how can we treat this? Some simple ways you can do this at home without seeking, professional help or medications or anything of that nature is control what you can control. Control your day activities. Make a plan for the day. Make objectives. Okay, for today, I'm going to do this, this, and that. Make weekly plans. Do individual plans. Do family plans. The other thing is you can socialize. Look what we're doing right now. We're talking by phone. Communicate with your friends. If you always had a good friend that you always would speak to, bounce things off of, communicate with them. And maybe it's better that you do a video chat as opposed to, just calling them on the phone. It's the next best thing, as they say. And the other thing is just realize, you're doing the best that you can. And that's all you can do. So, and if that doesn't get you through it, seek professional help. I have psychologists who work with me and they deal with this all the time. I have one colleague who deals specifically with not only professional burnout, but also caregiver burnout. And if none of us are first responders, we're definitely all caregivers right now. We're helping each other, while we're trying to help ourselves. So that's the important thing. Now, anxiety and insomnia, how do those things play together? Well, one of the major symptoms of anxiety is insomnia. And insomnia simply is an inability to sleep most nights, not every single night, but most nights. And the way you'll know that is feeling fatigued or tired or just not yourself. You may not be able to think as sharply. You can't remember things, multitasking, forgetting things. You think, hey, I got a memory problem. So most patients don't come to me for insomnia or for anxiety. They come to me because I can't think well, or I'm not as sharp as I used to be, or I'm just tired. Sometimes they'll say, I feel depressed. And a lot of my patients will say, will go to their primary doctor saying, I'm just feeling run down. I'm not myself. I'm sad or I'm irritable. And they'll say, oh, you may be depressed. Sounds like you're depressed. Here's an antidepressant. Really, you're fatigued. And that's one of the key questions I'll ask a patient. Are you really fatigued or are you depressed? Or are you anxious? They may say both. They may not know. But it's really important for you to distinguish the two because they're two sets of different problems. So before I get into insomnia, let me talk to you about what healthy sleep is. Does anybody know the definition of it? It fluctuates from expert to expert and from year to year. Right now we're saying 69 hours of sleep is sufficient for the definition of a good night's sleep. I define it as the amount of sleep you need to function properly the next day. Some people may only need 4 hours, some need 10. And teenagers, as infants, need the most amount of sleep. And by the way, don't be surprised if your teenage children are now going to bed a little bit later than they're supposed to during the school days and getting up later. They need the second most amount of sleep besides a newborn. So they need to sleep, and they typically don't fall asleep till like 11, 12, 1 o'clock in the morning, and then they don't tend to get up till 10 in the morning. That's what their body does. The brain grows both during infancy and during their teenage years. So they're just actually listening to their biological clock. So what is insomnia? By definition, not sleeping well 3 nights out of a week for more than 6 months. So what can cause that? Obviously, stress and anxiety. Could be medications, could be physical pain. So before I get into the different types of insomnia, what can you do to help with a good night's sleep? Go to bed in a cool, dark, quiet room. Now for the women, they tend to like it cold. Men tend to like it warm. I'm saying cool. Whatever cool is, that's good for you. By definition, we know that when people go to sleep, their body temperature drops by 1 to 2 degrees compared to when they're awake. So the elderly people, they lose that thermal regulation. That's why it's good for elderly people to have like a fan on or to make the AC a little bit cooler. That helps promote good sleep because it's telling the body, it's a cue that, hey, I'm ready for sleep. My body temperature's dropping. That leads me to the next topic. Find a good transition to go from wakefulness to sleep. If you look at your pets, they do that, right? They'll find a way. They know when they're getting ready for sleep. So that's what you need to do. And I'll tell you, during this pandemic and everything you hear about is COVID-19 and pan-epidemic, I would strongly recommend for 30 minutes before you go to sleep, don't watch, listen to the news. Just find a way to relax and unwind, whether it's yoga, stretching, reading a book, talking to friends, but find a way to chill out for 30 minutes before you go to sleep. And it takes about 20, 30 minutes once you're in bed to fall asleep. That's okay. It may take a little bit longer nowadays, but that's all right. And what we're looking for as sleep specialists is sleep efficiency. The amount of time you sleep as a numerator on top, and the denominator is how many hours you're in bed. So it should be 90%, meaning 90% of the time you're in bed, you're asleep. So what do I tell my patients? The bed is only for sleep. Some sleep specialists say sex too, but let's just say sleep. When you have your home office, you do your work there, right? When you go to the kitchen, you eat on the kitchen table. You don't sleep on the kitchen table, and I'm sure you don't sleep on your office desk. So why would you eat in bed? Why do you bring your laptop in bed? You subconsciously have to know that your bed is only for sleep. If you like the bedroom, find a chair. But the bed is only for sleep. So as soon as you lay down, subconsciously, your body, your mind is saying, this bed is for sleep. It's very important because a lot of people don't, especially nowadays, trying to find different rooms to find comfortableness. You don't want to be cooped up in the same room, but don't do your work in bed. If you don't have a sleep problem, do whatever you want. So what is insomnia? So as I gave you the definition earlier, but there are 3 different types of insomnia. There's onset insomnia, maintenance insomnia, and then frequent nocturnal awakenings, and then actually they all lead to fatigue. So onset insomnia means it takes you too long to fall asleep, like I said, more than 20 minutes. So what can do that? Obviously, if it's psychological, then that's an issue that you're going to have to deal with. You know, as I just said, find ways to unwind the mind. A key point that I tell a lot of my patients is, why don't you just plan your day's activities early in the evening? Because everyone says, oh, this is what I got to do. They try to remember right before they go to sleep. And that puts added stress and extra pressure to fall asleep. Do it beforehand. That way, or put it down on your laptop or your computer, and that's all you need to do. You know, so plan your activity. And remember, transition. Be consistent from night to night how you want to fall asleep. So if you know you wash up and go to bed right before you go to sleep, do that every night. Your body subconsciously, psychologically, you're saying, this is my behavior. When I brush my teeth before I go to sleep, then I shut off the lights, I relax, then I go to bed. You prepared yourself, you transitioned yourself to go to sleep. Sometimes you can't fall asleep. It could be because of medications you're taking, or over-the-counter supplements. So you have to be aware if you're having problems falling asleep or staying asleep. Maintenance insomnia. You know, one of the biggest things I find out with my patients is that they'll take over-the-counter supplements. And what do? They take it and say, oh, for example, I take Benadryl. If you take it once in a while, that's fine. It'll help you fall asleep. But don't be surprised if you're waking up in the middle of the night unexpectedly and not knowing why. Those medicines do it. If any of you had a drink, or got too drunk before you'd fall asleep easily, right? You crash. What happens? You wake up in the middle of the night, you can't fall back asleep. Those over-the-counter products have the same ones. There's some herbal remedies that can help with that. But the other factor, by the way, is medications. You may not be aware of it. Your doctor may not have told you about it. And sometimes, it's not one of the typical side effects of the medicines is falling or staying asleep, and you don't realize it. Now, some people have primary sleep disorders like sleep apnea or restless leg, and that can be why you're not staying asleep, and you think it's another cause. But you can have anxiety and sleep apnea. You can have MS or rheumatoid arthritis. You can have reflux, gastric reflux. You try to lay down and that just burns your chest and your stomach and you can't fall asleep. So there are a lot of reasons, even medically, and even medications that can cause maintenance insomnia. So that's important to know. Is it onset insomnia or maintenance insomnia? And then sometimes people have frequent nocturnal awakenings. You wake up back in the middle of the night. Sometimes everyone just goes to the bathroom. The problem is reinitiating asleep, falling back asleep. So why is that? For whatever reason, it could be what we call psychosocial insomnia, meaning you have a psychological stress or anxiety. It leads to insomnia. Eventually that anxiety goes away, but the insomnia persists. So, but again, that you may not realize that unless you deal with a professional, whether it's one of my psychologists or myself. But when you reinitiate sleep, you have to fall back asleep the same way you initially fell asleep. So that way you keep that routine. And don't look at the clock. If you look at a clock saying, hey, it's been 15, 20 minutes, I can't fall asleep, that adds pressure to you falling back asleep. And it's actually counterintuitive to do that. So, and the last one is feeling tired or waking up early. If you're waking up too early, again, it could be medications, it could be anxiety, it could even be a sign of depression. But if you're waking up earlier than you expect, one thing that I always ask, do you feel rested when you wake up? Maybe you don't realize it that nowadays you only need 4 hours. Back when you were younger, you needed 6. As long as you feel refreshed upon awakening and refreshed throughout the day, whatever amount of sleep you had the night before is fine. But if you're waking up too early and you're feeling tired, don't be surprised if it's medications. Don't be surprised if it's a medical problem. But obviously, if it's affecting you in the daytime, you got to figure that out. And that's really the number one reason I see patients. They don't come to me for insomnia or even anxiety. They come to me, I'm tired or I'm depressed or my headaches are worse, my back pain's killing me. And I can't treat all of that if I don't know properly and you don't know about your sleep or lack thereof. So education is really key. And for me, one of the most important things is educating you so you can be a partner in helping yourself get better. Because I gotta tell you one important thing, especially during this pandemic, sleep is healthy. There's no substitute for sleep. When we now know that sleep is crucial to help fight off infections, your immune system actually is dependent on sleep. And if you don't get sleep, whether it's because of a medical problem, the anxiety, it alters the ratio of your sleep. There's some immune system that are inflammatory and some that are anti-inflammatory, and they both serve a purpose. But if you don't have enough sleep and you're sleep deprived, especially during this time, you're depriving yourself of the best possible way to fight off this infection. You're depriving your immune system to work effectively and efficiently. So a good night's sleep is good, especially during this pandemic. And I'm here. I mean, if you can't come to my office, I'm here by phone. It's called telemedicine. You know, we have a special app called Helo, Healow, that if you're my patient, or if you want to be my patient, you can do it that way. But even the government said that if you don't feel comfortable doing that way, or you don't know how, you can do telemedicine any which way you want. You can just do it like we're doing now. But I'm here to help you. I have psychologists here who can help you. You know, don't be afraid to ask any questions. Don't be, it's okay. I mean, people are angst. We have anxiety. You know, if it's affecting your life, your quality of life, then that's a problem. If you can find coping skills, great, and that's what you should do. So again, my name is Dr. Jeff Steinberg. I really appreciate you taking the time. I know these are difficult times, especially, but I want you to remember to be the 3 C's. Be compassionate, be conscientious, and be calm. And I thank you very much, and I wish you all to stay well and Godspeed. Thank you.